Okay, hello everyone. Welcome to Pre-Dental Universe. We have Dr. Ghiam today with us. She's an orthodontist and she just graduated from Linda Loma. She'll be sharing her journey with us and giving us some of her experience as a recent graduate. And without any
Hello.
further ado, let's get started.
Hi, everyone. So my name is Dr. Chantelle. So thank you for having me. So today I'm kind of going to go over a little bit about my journey and the field of orthodontics. And then at the end, we'll have time for a Q&A. So let's get started. So I want to start off with just a little bit of background about myself. So I went to UCLA for undergrad, and I graduated with a Bachelor of Science in Psychobiology, which took 4 years. And then I continued and stayed at UCLA for another 4 years, where I got my DDS, my dental degree. And then finally, I completed my specialty program in orthodontics at Loma Linda University, and that took about 27 months, a little over 2 years, and I got my Master of Science. So a little bit about ortho programs. There are some that are 2-year programs, and there are some that are 3-year programs. Specifically in California, Loma Linda, UOP are 2-year programs. And then we have like UCLA, USC, UCSF, those are 3-year programs. And some programs you have to pay a tuition for, and some programs provide a stipend. So when you start researching into what schools you want to go to, that's something to, kind of watch out for. And then a little bit about kind of how I got into ortho. So, when I was a dental student, you don't get too much exposure to orthodontics while you're in dental school. So, I had to kind of actively go out and kind of shadow and see if that's really what I wanted to do. What kind of drew me to the field was the aspect that, you mostly treat children and teens. So that really drew me into, orthodontics, and the fact that you really develop relationships with your patients. Unlike general dentistry, where you might just see the patient one time and then they might not come back for, let's say, another few months or a year. With orthodontics, right, you're seeing the patient like over the course of 2 years, 3 years. So you really develop a relationship with them and their families. So that, those were kind of like the main reasons that really kind of drew me into the field. So now a little bit about what is orthodontics. So some of you already might know. So it's a specialty that focuses on the diagnosis and treatment of dental and facial irregularities. So some of the things that it includes are crowded or protruded teeth, spacing, right, gaps between your teeth, jaw growth problems, missing teeth, extra teeth. And like I said, we treat patients of all ages, mainly children and teens, and adults. So I wanted to a little bit touch base on kind of when is the preferred time for orthodontic care. So, there's a huge misconception. A lot of people think that, it's time to get braces when you have all of your adult teeth. And that's kind of a big misconception. The best time is when kids are actually still growing, right? Before they have their pubertal growth spurt. And it's when they sometimes have a few remaining baby teeth left. So that's usually around the age of 10 to 13 years old. Again, it can differ, child to child. The reasoning is because when kids are growing, their bone is a lot softer. And so it's a lot easier to move their teeth, and it's quicker as well. The AAO, which is the American Association of Orthodontists, they recommend that children should have their first visit with an orthodontist no later than age 7. That doesn't mean that, we're going to start putting braces on at age 7. It just means that if there are any issues that need to be addressed, sooner than later, it's important they come in and we kind of take a look around the age of 7 years old. So a little bit about, a typical work day. So like I said, I just graduated. in September. So initially, when I graduated with the pandemic, it was quite difficult finding a job, just because offices had just reopened. And because offices had just reopened, they weren't seeing that many patients. Most offices weren't really looking to hire an orthodontist. But thankfully, as time went on, I ended up finding a full-time job. So I currently work Monday through Saturday, and my job is either 9 a.m. to 6 p.m. or 8 a.m. to 5 p.m., depending on the office. On average, it differs, but usually most offices, I see about 60 to 80 patients a day. So I know, to you, it might seem, oh my God, that's a lot. You also have ortho assistants, right? So these are assistants that are trained in orthodontics, and they're amazing. And usually you have about 4 to 5. So they're the ones that typically do most of the adjustments. They do the bonding. They pretty much almost do a lot of the, adjustments. So, your job as an orthodontist really in residency is to really learn how to diagnose and treatment plan. So when a patient comes in, you look at them and okay, what you're going to do. That's kind of really what an orthodontist should master. Again, it differs. I have, there are some offices, slower offices can be 30 patients, 20 patients, and then very, very high volume offices I've seen that see 100 patients or even 120 patients. So it can range, but usually it's about 60 to 80 patients a day. As an orthodontist, you don't typically stick to one office. So it's a little bit different than a general dentist, right? A general dentist usually has maybe 1 or 2 offices. But as an orthodontist, most offices, they're open sometimes once a month or twice a month. Most I've seen is maybe once or twice a week. So in order to have a full-time job, you kind of need to travel and go to several different offices. So I currently work all in LA, in Encino, Agora Hills, and Valencia. So all in the San Fernando Valley area, for those of you who are familiar with the LA area. So a little bit about kind of what patients complain about, right, when they come in to see me. So, the most common ones are, straightening crooked teeth, closing wide gaps between their teeth. They have bite problems. They have speech and chewing problems, or they have these 4 common issues that you see on the screen. So, the first one right here that I'm pointing to is an underbite, right? That's when the lower teeth are ahead of the top teeth. They have a cross bite right here. They have a deep bite, right? Or an open bite, okay? So again, while you're in residency, you'll learn in depth about all of these issues, but patients come in and a lot of them know that they have an open bite or a deep bite or an underbite. So those are common complaints of patients. So what happens at that first appointment? So when a patient comes in during the consult, what happens is usually we take full records. So we take photos, we take x-rays. So what you see here, this is a panoramic x-ray. It's a full view of the patient's dentition. We take a lateral ceph. That's what you see here. This x-ray will become your best friend when you're in residency. I'm not going to go too much in depth about this, but you gain a lot of information from this x-ray. You'll learn how to trace it while you're in residency. But these are the 2 kind of standard x-rays that usually every office takes, as well as molds of your teeth. So they take upper and lower impressions of your teeth. And then as an orthodontist, you come in and you do your intraoral and extraoral exam. So that usually can take anywhere from like 5 to 10 minutes. You do your exam and then you sit with the patient and the parents and you kind of discuss what you found, and you discuss kind of, what the treatment is, how long it's going to take, so that, all together can take about 15 to 30 minutes. But that's kind of what the consultation entails. So a little bit about kind of what, orthodontics, it's always advancing with new technologies. These are just some. So, digital x-rays and 3D digital imaging. You know, we take a cone beam CT. So some offices take a cone beam CT. A cone beam CT is pretty much, you go in, you put your head in this kind of like tube in this machine, and it provides a 3D image of your teeth. Okay, so for patients that maybe have impacted teeth, right, this is a great tool because you can the 3D visualize where that tooth is in the bone. You can also visualize the TMJ, right? Those are the joints. And also analyzing the airway. You'll learn that the airway and orthodontics have a very close relationship. Another great advancement in orthodontics is intraoral scanners. So if you don't know by now, right, a lot of things like Invisalign have started, they use intraoral scanners. So traditionally, right, when you go to a dental office and they want to take molds of your teeth, they put this gooey material, and it usually takes about a couple minutes. It's very messy, and patients they don't love it at all. So now a lot of my offices that I work at, we actually have completely eliminated this gooey material. We now use just scanners, so it's so much cleaner and patients love it. And you can see that this photo that I have right here kind of illustrates there's different scanners out there, right? One of them is the iTero, which is what Invisalign uses. But essentially, it just scans your teeth. It can take 2 minutes, 3 minutes. And then the patient can, immediately see their teeth on the screen, on the computer. And patients love it. They think it's so cool. So that's one of the kind of, in my opinion, one of the best advancements in orthodontics. We also have 3D printing. So kind of some of the uses of 3D printing is indirect bonding. So what that is essentially, instead of putting the braces on each individual tooth when the patient is in the chair, you do that on the computer. So it's really cool. You pretty much place the bracket on the patient's tooth. All of it is digital. You do it on the computer, and then a printer prints a template for you. So when the patient comes in, you just pop that template in the patient's mouth, and then you have all of the braces now at the same time on the patient's tooth. So a lot of offices utilize this. It's a very neat, kind of procedure. It minimizes a lot of chair time. So when the patient comes in, and instead of taking now an hour putting braces on, now it could take only maybe 10 or 15 minutes. Also making retainers, right? You can also make retainers from 3D printers. And I mean, obviously Invisalign, right? Clear aligners has been around for some time now, but they're just one of many clear aligners. So now I want to kind of touch base. Now you know a little bit about orthodontics, but now I kind of want to go into, well, I know most of you are pre-dental students. So you're thinking, well, I first got to get into dental school and then ortho. So my advice to first getting into dental school, truthfully, I want to say dentistry, especially general dentistry, is physically straining on your neck and back. My husband is actually a general dentist, and we graduated together at the same time in dental school. And he's been working for 2 years now as a general dentist. And, he comes home and he says, it's hard on his back and neck. The good thing about orthodontics is that, again, it's not as straining. You have your ortho assistants that are doing most of the work. Your job essentially is to really take a look at the patient and kind of pretty much tell your assistants what to do. So you really need to master, like I said, diagnosing and treatment planning a case. It's not a very active job. It requires a lot of sitting. So keep that in mind. I would say shadow many dentists, right? Not just one. Do as many as you can, and then have one write you a letter of recommendation. So I think that's really key is, when you're thinking about what letter of recs to get, one should be of a dentist that you've shadowed maybe, for maybe a year. I remember a pediatric dentist for about I think a year and a half. And then I had him write me a letter of rec for dental school. So, that's one thing I would say. Shadowing is like key. It's, if you want to go into dental school. Didactically, I would say your DAT scores, your GPA, those are the two most important things, right? Like if they want to look at didactically, you want to have, good DAT scores and a solid GPA. Another thing I would say is develop your art skills. I'm not a very artsy person. I never was. I pretty much only played the piano, but that's pretty much it. But I would say, if you're into drawing, into painting, those are all great things to write on your application. Okay, anything that kind of uses your hand. And I will say it will make dental school a lot easier. Like I said, I wasn't an artsy person, and when it came to the lab portion of dental school, I struggled. So, keep that in mind if you do any sort of like pottery or, like I said, painting, drawing, anything, playing the piano or even the guitar, any instrument, that essentially uses your hands, I would definitely kind of, write about that. Other things really I would say is like I said, shadowing, leadership, really be involved with your pre-dental organization. They're a really good resource. And I would say it's not always, I've seen some students, they just get involved in like 10 different organizations and they just write 10 different groups that they're involved in on their resume. And that's not always kind of what these people are looking for. They want to see that you kind of hold a leadership position. So even if it means picking like 2 or 3 like groups, I would pick 3 that you're really passionate about and really just hold leadership positions in those groups. I know if you don't know, the American Student Dental Association, that's ASDA, they're also a great resource. You can also be a pre-dental member of ASDA while you're in college, okay? So you don't have to wait until you get into dental school. So you can get involved with ASDA. They're also a great resource to you. Do community outreach. Like I said, that's a big thing as well that you can write on your resume. I personally loved academia. I loved teaching. And so I got involved with that in college, and I did a lot of teaching while I was in college. And then the last thing is really research, right? And that really depends on what school also you're applying to. I mean, schools like UCLA, UCSF, they love research. So if you want to get into those schools, you've got to be doing research. So I mean, yeah, those are, in my opinion, if I could sum it down, like I said, shadowing, I would say, leadership, I would say community outreach, and research. Those are kind of like the big things I would kind of focus it on when you are, filling out your application, when you're getting letter of recs. So yeah, and then how to get into ortho residency. So once you're done with those 4 years, right, then you kind of, essentially you have to do it all over again, okay? There's no secret recipe. I mean, it's essentially you're just redoing everything you did while you were in dental school. So in college. So, now instead of shadowing general dentist, you're shadowing orthodontist, okay? And you want to have an orthodontist write you a letter of rec. You want to just keep building on your resume. You want to continue doing research. I truthfully didn't do too much research while I was in dental school. I just had a lot on my plate, and I did other things, and I didn't really get to do research. But again, if you want to go get into schools that are heavily based in research, you got to do research. If you want to do ortho, do research that's related to ortho. What else? I know again, like while I was in dental school, I was really involved with ASDA. I held, several positions in ASDA, both on the local level and a district level. So I would say, again, pick a few things that you really love and kind of get involved with that. Some programs, not all, want you to have some experience. So if you're not a really strong applicant, ortho it's a competitive field. If you're not a very strong applicant, I have given advice, to some students to just work for a year or 2, gain some experience, or do an AEGD or GPR program. Okay, there are 1-year program that are in general dentistry. Okay, and so some programs, like even my program Loma Linda, they actually like it when students who apply, they have some work experience, or they've done an AGD or GPR program. So it just boosts up your resume, and it's something that you can write. So again, that's, some of the very similar, again, like I said, to get into dental school, it's the same things you got to do in order to get into ortho. A little bit about, some people have asked me kind of, what has changed? How has COVID kind of changed ortho? Well, I think across the board, everyone can say infection control is at a higher level. We have more PPE. When it started out, we did schedule fewer patients. Now I want to say it's almost, relatively back to normal. Honestly, like even during the pandemic, by June, my patients, while I was in residency, my patients were contacting me, telling me, when are we going to reopen? When are we going to reopen? Like, my kids want to come in. So, honestly, our patients were all very, very, very eager to come in. And, even now, we really don't have many issues. We take our, we take our precautions, we take temperature, but, most patients are all very eager to come in. The one thing that I will say, is we have transitioned to more virtual consultations. So, in order to limit, the amount of office visits, because of COVID, a lot of times, patients will take photos of their teeth. Okay, they'll upload them online onto a platform, and then, I go in, I view those photos, I view their X-rays, and then I kind of just chat with them, on Zoom or, whatever, for 5-10 minutes, and I address, their concerns. I kind of take a look at their photos, and I do a mini virtual consult on, like, what I think, how long it's going to take, and kind of tell them what I see, what their treatment is, so that when they come in, then they're kind of ready to start. So that's one thing I will say that, I've done more of since I've graduated, is I've done quite a bit of virtual consults, and parents actually love it because, again, you're limiting the amount of time they have to come to the office. And then the last thing I kind of wanted to show you, so again, since I just did graduate, there aren't that many cases that I've started and completed, because, cases can take 1, 2, 3 years. But this was a surgical case that I actually completed right before I graduated. This patient of mine, she actually had a whole Instagram account of her 2-year journey with me. So every time she came in, she would actually take photos of herself, and even while she was at home, she would take photos. She would explain to all her viewers kind of what was going on with her treatment. So, she actually started out, so you can see right here, she started out with a very huge underbite. Okay, you can see her lower jaw is her lower jaw is way ahead of her upper jaw. So, she was also done growing. She was, I think when I saw her, she was, 17, 18 years old. So, we can't correct this with just braces alone. This is a type of case that you need to work with an oral surgeon, and you need to do surgery. So we first expanded her upper jaw. So some of you might have had this. It's a little screw that goes in the roof of your mouth. So, she had a very narrow upper arch. So we actually expanded her upper jaw first. So we set her up for surgery. Then she goes in, and then they did surgery. You could see there's a dramatic improvement. And then she comes back to us, and then she was in braces for another 6 months after her surgery, and we finished her up, and then we took her braces off. So you can see, like, her before and after, just from her profile, there's been, a huge improvement. And, even just with the patient, one thing about ortho you'll see is that when patients come in at the beginning, sometimes, they don't want to smile, they have a lower self-esteem. By the time you're done with treatment, they can't stop smiling. They're so happy. I mean, my patient, she just couldn't stop smiling, and she constantly took pictures of herself. People were constantly telling her how pretty she looked, how different she looked. I still keep in touch with her now, but it just shows you that, you really develop relationships with your patients. Yeah, I mean, that's pretty much, I would say, all I had. I left my Instagram handle right here. So if you guys ever have any questions about, getting into dental school or getting into ortho, you guys can DM me. I'm more than happy to answer any questions that you guys might have.
Okay, thank you, Dr. Ghiam. We actually do have a few questions in the chat that I was hoping that you can answer. So
Yeah.
the first question is, how is your experience studying at UCLA Dental School? And what are your thoughts about like the faculty, student body, and just the curriculum in general?
I will say, I think that while I was there, we had a lot of transitions. We had a new dean. There were a lot of good transitions that were going on. So I think it's gotten better. But truthfully, it's a hard program. I will say, especially the first year, first 2 years, I will say it is very difficult. But you will gain a very strong foundation, both didactically and clinically. Um, so I mean, I was happy with majority of my faculty. Again, you'll kind of find your niche. You'll find kind of you know what faculty in any school. I think you'll find faculty that you like and you dislike, and I think that's natural. But overall, I think you gain a very strong foundation didactically. So when it comes to like your boards, for example, part one, part two, um, you know UCLA prepares you very well in terms of that. Um, and again, clinically, again, for me, because I knew I wanted to specialize, um, I wasn't so worried about, like the clinical aspect of general dentistry. But again, I mean, everyone really there is really helpful. The faculty are super helpful. And they're not trying to fail you out. I mean, again, I was a person who like I struggled clinically. But again, they're there to help you. You have tons and tons of faculty, both part time, full time. Um, you know, they're all amazing, and I think that you have a close. Your class. My class was about 80 something, mid 80s. So it's not a huge class either. So you're really close with all your classmates. But overall, I mean, I I really liked UCLA, even though it is difficult. I think while you're in it, you don't realize, but once you're out, you realize that it was a great program, and truthfully, you'll learn a lot, and they set you up, really well for the real world.
Thank you for that response. And another student asked, like, when you were deciding what dental schools to apply for, like, what did you specifically look for, and what schools did you apply for, if you're willing to share?
Yeah. So, like I said, so I live in Los Angeles in California. So, for me, I will say location was key. I didn't want to move too far away. So, some people thought I was crazy, but I only did apply to California schools. I did debate it a little while, but again, you also have to evaluate how much of a strong applicant you are, right? If you are a very strong applicant, you have a high DHT score, you have a high GPA, you're really involved, you've done research. I mean, you don't need to apply to like 40, 50 schools. But again, for me, also kind of location was important. So I applied only to California schools. Um, and yeah, so I mean, for me, that was like for everyone, it's different. And if you're willing to go anywhere, then I'll say, broaden your, kind of apply to more schools. Um, but yeah, I only applied to those schools. I mean, for me, mainly it was like location. Um, and I spoke to a lot of dental students who were in different programs. So I will say, like, talk to dental students at USC or UCLA or whichever school that you want to go to, and kind of get a feel of how their program is and what they like and what they dislike. Because I can only speak on UCLA. But yeah.
What criteria do you use for deciding between braces and Invisalign when a patient is a good candidate for either one?
So, if they're a good candidate for either, right? So there are certain cases where it's a very difficult case, and I tell my patient, I recommend braces. Or if I think that this is a case that actually, would be great for Invisalign, I will say this is a great case for Invisalign. And there are times that essentially you could do both. So you have to present both options to the patient. And then at that point, it's their decision. I mean, you have to tell them the pros and cons, right? With Invisalign, it's more hygienic, it's removable. So you got to, tell them both options. Usually Invisalign is more costly depending on the office, but, most of the offices I work at, the Invisalign, because there's a lab fee, the Invisalign is more expensive. So sometimes, depending on the location, it can come down, to the cost for the patient. But I mean, yeah, you have to present both. There are times where I will say, my first recommendation is Invisalign, then it's braces, or first it's braces, then Invisalign. Or I'll say you could do it either. And at that point, it's completely up to the patient. If I'm leaning more towards one, I will tell the patient, if it was my daughter, I would do this for this reason. But as in residency, you'll learn as well, and while you're in practice, you'll learn that certain cases are more easily achievable with braces, and some cases are great candidate for Invisalign or for any clear aligners. But yeah, essentially, you should tell the patient both treatment options.
So kind of piggybacking on that question, so would you recommend if a patient if Invisalign was ideal for that patient, would you recommend like any offliner brands like Smile Direct Club in lieu of Invisalign?
No, I will not. One thing I will say is Smile Direct Club, Candid, all of these, offline products, they're not being supervised by an orthodontist. Okay, so it's kind of like the do-it-yourself mentality, which I don't personally agree with. Just like I'm not equipped, just like I'm not equipped to do certain things, right? You go see a specialist when you want to do a root canal, right? For everything, you go see a specialist, right? You go see whoever is experienced in that field. And in my opinion, when it comes to these offline products, they're not taking a look at your teeth, at your gum. There are so many different things, right? When I do my exam, I look at gum recession. I look at bone loss. I look at their TMJ, if they have any symptoms. You look at so many different things, and with it's like these products, these other offline products, they're not always taking that into consideration. So truthfully, I would never recommend someone in my family, right, to do that. I would say even if it's not an orthodontist, at least a general dentist, at least they have some knowledge on moving teeth. So I would say it needs to be supervised by a doctor or a dentist, so that you need to be coming in every 4 to 6 weeks or whatever, 8 to 10 weeks at the very least, so that you're being monitored. So yeah, that's my opinion.
Thank you for that. And another student asked, is the machine that you mentioned on your slide talking about technologies in orthodontics, is it the same thing as the CEREC machine? And I think the student was talking about the CBCT.
The CEREC machine, that's actually used by general dentists to make crowns. The machine I'm talking about, cone beam CT, essentially it's like an X-ray machine, right? So you go in and it takes a 3D image of your head and neck. So yeah, they're completely different. Not every office has a cone beam, right? So most of the offices I work at do not have a cone beam, but in residency, all my patients were required to have a cone beam CT. So it's a 3D image, right? So when you take an X-ray, most of them are 2D images. But the cone beam, I mean, it is very expensive, and you are exposing the patient to some ionizing radiation, but it's useful when you suspect you have an impacted tooth, right? Or someone has an airway issue, or someone has a TMJ problem. So those, in certain cases, it's very useful to take a cone beam CT.
Thank you for that. And so another student asked, why did you select dentistry, and why did you pick ortho as your specialty specifically?
So I first was pre-med, I think, as many people. I was first pre-med. I even, my first year of college, I did some, pre-med shadowing and stuff like that. But I, also, med school is very long. So that was one of the reasonings. I didn't want to be in school for that, for that long. Um, and I have a lot of dentists in my family, so I was fortunate enough to shadow a few different of my family members. And it drew me to the field in the sense that I wasn't going to be in school for that long. And I always wanted to do something in the healthcare field. That was always, I never thought about anything else other than health. And so for me, it was kind of like either med school or dental school. And once I got into dental school, I will say, not that I didn't love dental school, but it wasn't really kind of what I saw myself doing for the rest of my life. And when I started, shadowing orthodontists, and when I kind of saw kind of what they were doing, again, ortho is very different than general. It's very different than any other specialty. So it kind of really drew me into the field. And like I said, you really develop relationships with your patients. You get to see your patients over 2-3 years. Most of them are teens, right? They're teens. I have patients that are as young as like 7, 8 years old. But again, I also have patients that are as old as 70. So it ranges. But I would say the majority of my patients are children, and that's what I really like. I like working with children. And I like that, they come in every once a month and they see me. So it's like not just you come in for a filling and then you're gone for another 6 months or a year. So yeah, I mean, it's a very clean field in the sense that you're not really dealing with a lot of blood, and it's very clean. I'm sure if you've ever had braces and you've ever been in an ortho office, very it's a very clean specialty in the sense that again, you're not dealing with much of blood, and usually your patients are very compliant. I mean, like, they're there because they want to fix their smile, they want braces. So usually you're not really like fighting with them. You don't have to convince them to to get braces, right? If someone has a filling or has a cavity, sometimes they're hesitant, right? Because they're like, oh, I can't afford it, this and that. So I like that aspect, that usually there's not much convincing you have to do. A patient who comes in is interested already in getting braces. So yeah, I mean, that's kind of why I kind of chose ortho. I mean, I love it. I mean, again, I've only been working for a few months, but I truly kind of love my field, and I don't regret it at all.
So, kind of touching on the same subject, a student asked, like, in your dental applications or interviews, did you mention like the more realistic aspects of like why dentistry, like how you were saying less time in school and stuff?
That's a good question. Not necessarily, I will say. You know, I would say focus more on the fact that you're developing relationships with patients, that, you're building their self-esteem. I mean, those are the kind of things. Yes, of course, it is less school, but that's not necessarily what they want to hear, right? They kind of want to hear, well, why specifically, not just because it's less school, why specifically you want to go into this field. So I would say, even if those are the reasonings, okay, I would say the things you kind of want to focus in on are reasonings like, you're building relationships with your patients, you're seeing children and you love to work with children, stuff like that, stuff that I mentioned earlier, that those are the kind of things that I will say. If they ask you why you want to do ortho, when you're saying why, if you're applying to dental school, obviously it's different. You got to write why you want to do dentistry. Once you want to apply to ortho, you got to write why you specifically want to do ortho. So when it comes to writing why you want to do dental school, I will say you want to focus on, want to have patient education, oral health, right? You love to educate your patients on oral health. That's one thing you can write about. You like, to develop relationships with your patients. Yeah, those are the kind of things that if they say why dentistry, I would say those are the things you want to write about. Like you like to work with your hands. That's the main thing about dentistry is like, especially if you already have, if you're artsy and you do some artsy things like painting, you can bring that in and say, I've painted or I play the piano. And, I want to continue working with my hands. I'm an artistic person. So those are the kind of things that you want to talk about when, on the application, when they ask you why you want to do dentistry.
Okay, thank you for that. And I know that you mentioned that you just recently graduated from dental school, but have you ever had any pre-dental students shadow you recently? And if so, if you wrote a letter of recommendation for them, what did you write specifically?
So, I don't, just because I don't have my own office, it's hard for me to have, students come shadow me. So, if I had my own office, then yeah, I would love to have students come, but because I work at other offices, it's a little bit more tricky. If a student is really adamant about coming, I can always ask one of my offices and see if they are willing to have a student come and shadow. But yeah, I once you do develop a relationship with an orthodontist, and you come shadow them for a few months, then yeah, you definitely can ask them for a letter of recommendation. And I would write a letter of recommendation as well. If I had a student that had come and shadowed me for, it'd have to be more than just for one visit, but if it's for several visits or so, that's definitely possible.
Okay, thank you. And so another question a student asked is your patient case that you showed in your PowerPoint the most drastic change you have like ever seen in the before and after pictures?
Well, surgery cases are probably the most drastic. But again, no, I had more cases in residency, but again, with the pandemic, we were shut down for essentially 3 months. So a lot of my cases that were close to finishing, I couldn't finish because of the pandemic and because I graduated. Um, but no, there are other cases that I've seen. Like that was, obviously a severe case, but there are also cases where, especially in children, young children, um, for example, cases where, they have a deficient lower jaw and, you're pulling the lower jaw forward, just mainly from, rubber bands, not even surgery. I'm saying just purely braces, you'll see drastic improvements. A patient who has a lot of crowding, like I had, you'll see patients who come in with just tons and, upper and lower crowding. So you'll see, they have teeth that are in crossbite. So no, the one I showed you is one of probably, a drastic change, but there's definitely other cases that, are have major improvements as well.
Okay, thank you. And since you said you did a lot of teaching in undergrad, would you ever consider like a faculty position at dental school?
I actually would. Yeah, I love teaching. It's always kind of been on my radar because I just graduated. I kind of wanted to first start working and gain some more work experience. But down the line, yeah, I would love to. I would love to hold a faculty position. At a school kind of near LA, either UCLA or USC or whatever opportunity comes my way. I haven't really gone out for it just yet, just because, like I said, I just graduated and I kind of want to work as much as I can right now. But yeah, that's definitely on my radar for the future.
What do you think like made you a standout applicant for dental school and for residency?
So for dental school, like I said, so in college, I did a lot of academia. So I was a peer learning facilitator. So Essentially, like I tutored a group of students about twice a week. So I did a lot of academia, like I said, in college. I was involved, it's a little while ago, so I have to look at my resume, but I know I was involved. I had leadership positions in a couple different organizations. And then I also did shadowing. Like I said, I shadowed a pediatric dentist. It was in a low income neighborhood. And I went there once a week for about, I think, a year and a half. And I ended up getting a letter of rec from him. And he was actually a faculty member at UCLA. So, obviously that helped. He wrote me, a great letter of rec. So yeah, I think my main thing was my shadowing that I did. I did a lot of research. I will say in college, not so much in dental school, but in college, I did a lot of research. I had a couple publications as well. So I did research. I did a lot of shadowing. And yeah, I did a lot of leadership. I had, a few different organizations that I held leadership positions in. And then for ortho, like I said, I didn't do too much research, but I was really involved with ASDA, and I did a lot of community outreach. So I was like one of the kind of chairs for community outreach, part of ASDA. So I did a lot of kind of leadership in ASDA, both on the local and district level. So ASDA also has a district level. So their district level is pretty much, they kind of oversee all of California and parts of other states, I believe, as well. So I held a leadership position on the District 11 board of ASDA. So I did that in dental school as well. What else did I do in dental school? I also did academia in dental school because UCLA has a BDP program. As if some of you have heard, it's called Basic Dental Principles. So I also was involved with academia while I was in dental school as well. So those are probably the major things. And as you know, UCLA dental school doesn't have a grade system. They don't have a GPA. So they have a pass, no pass, and honors. So essentially, for schools to evaluate you, it's very hard because you don't really have a GPA, you don't have a ranking. So you really have to excel in other things, like I said, with extracurriculars, research, stuff like that. So yeah, those are pretty much kind of like the main things that I did while to get into both dental school and residency.
Thank you. I was wondering, could you elaborate what ASDA is?
Yeah, so ASDA is the American Student Dental Association. When you become a dentist, then you become a member of the ADA, which is the American Dental Association. But while you're a student, you're an ASDA member. So when you are in college, you can actually be a pre-dental member of ASDA. So just like right now, you're a pre-dental member of of this organization. You can also be a pre-dental member of ASDA. And they're a great resource. They help you a lot, and they also provide workshops. I did a lot of workshops with them. Once you get into dental school, then you become a member of ASDA. So you're a pre-dental member in college, then you become a member. And then once you're a member of ASDA, again, there are so many opportunities to be involved. Like ASDA is a huge organization. It's a national organization. So it's all across the United States. Pre-COVID, they used to have conferences. So they would have a national conference once a year that you'd go to, and you would see dental students all across the United States. So it's, now with COVID, I don't think obviously they're doing that, but again, it's a great resource to have. You'll also meet a lot of dental students from other schools. So yeah, that's something if you're not involved with, I would definitely do some research and figure out kind of how to get involved. I think as a student, you don't even really have to pay for any fees, I believe. So that's something worth looking into, and it's great to write on your resume as well.
Okay, thank you. Thank you for elaborating on that. So another question a student asked is that compared to other dental specialties, is orthodontics using more technology, or like is it mostly technology?
I really can't speak about other specialties. I'm sure every specialty has their own technological advancements. Um, but like I said, with ortho, it's always changing. There's always growth. But yeah, right now, I will say like the main things, like I said, are like intraoral scanners. Um, they even have things now, a little bit about, there's something called dental monitoring where essentially, patients who have, Invisalign or clear aligners, they take this machine home with them, and this machine, they pop it into their mouth, and the phone slides into this little machine, and the machine scans their mouth, and then pretty much I get a notification if their aligners are not fitting properly, or if, for example, if they need to wait and not move on to the next aligner. So these are just some of the advancements. There's so many. But I mean, I'm sure other specialties as well have their own advancements. Again, like, I know general dentists have the Cirec machine. And again, I'm not too familiar with other specialties and, kind of what they use. But, I'm sure they have their own. But yeah, ortho, like I said, it's always growing. I'm sure in 10 years there's going to be even more advancements. But yeah, I wouldn't say it's more or less than any other specialty. I'm sure every specialty has their own technological advancements.
Thank you. And as you previously mentioned, you were involved in some research in the past. Could you explain some of the research projects that you've been a part of?
Yeah, so I did a lot of, I just fell into, I did research at Cedars-Sinai, and I kind of just fell into, it was not related actually at all to dentistry. So I will say, when you are applying to dental school, your research does not have to be dental related. I would say do any type of research you find. I just fell into research of the eyes, which was completely, because again, like I said, I was pre-med at first. So because I was pre-med, essentially when I started doing research my first year, I did the field of ophthalmology, eye research, specifically like um, diabetic corneas. That was my specific research that I did. But again, that's just kind of what I found. It wasn't like I was specifically looking for that. It was just kind of what I found when I entered college. But again, any research you do is great for dental school. So it does not need to be dental related. I think as long as the key is also to stick with it, is not to just do it for a few months. If the longer you do it, if you can do it for 2, 3, 4 years, if you can do it for all 4 years of college, that's amazing. If you can do it even for 2 or 3 years, it's still great. And if you can get publications, it's even better. It's not required, but again, it's just something to write on your resume. I will say, if you do research, get a letter of rec from your PI. That's super, super important. So, one of your letters should be from a dentist, and one of your letters should be from your PI if you do research. But yeah, that was kind of the research I fell into. It was, again, like I said, mostly related to the eye, and I got a couple publications through that as well.
Thank you. So do you have any advice about like how to write a great personal statement, or how you approached it?
So yeah, it's a great question. I've been, I've asked that many, many times. I will say, in your personal statement, you want to really show, right, the reader that you have certain qualities without specifically saying that you do. So what I mean by that is, for example, you want to show them that you have leadership skills, but you don't want to say, I have leadership skills, right? You want to show them by something that you've done while you were in college to show them that you have leadership. So if that is, for example, for me, it was, let's say it was teaching, okay? So I explained to them about my academia and what it entailed and the challenges I face with my students, right? So that demonstrates, let's say, my leadership and my communication skills. So those are the things they want to see. They want to see interpersonal skills, communication, and leadership without you saying you have those things. So when you tackle each paragraph of your personal statement, you should when I read a personal statement, each paragraph should show me one quality. If you can't get a quality out of that paragraph, that means you got to revise it. So, when I read, some students' personal statements, that's kind of what I'm looking for. Is each paragraph, I'll draw an arrow and say, okay, this shows me communication. This shows me interpersonal. Don't be all over the place. Don't talk about like 5, 6 different things. Pick like 2 or 3 things, major things that you did. So, for example, if that's research, that could be 1. If that's shadowing a dentist, that's 2. And then academia, for example, that's 3. I think that's roughly kind of what I did. Okay. And talk about those 3 things, right? Talk 1 paragraph about academia, 1 paragraph about your experience, right? Because they want to see you've had experience. So, you talk 1 paragraph about your experience with dentistry. So that's your shadowing experience and what you learned from it, right? That's key. 1 paragraph about, for example, your academia, which shows your communication skills. And then let's say 1 paragraph about your research, if you did a lot of research. Or if you were really heavily, let's say you were president of your pre-dental group, that's a great thing to write about, right? A paragraph about that. If you were president of any group, honestly, right? If you were involved in any sort of group and you were president, or if you started a club, those are the things. Pick 2, 3 things you were heavily involved with. Don't write about you're a member of your pre-dental group, you're a member of this, you're a member of that. That's all written in your application. So I would say talk about the things that you were involved with, you held a leadership position and you were involved with a long time, not just for a few months. Those are I would say that's kind of like the big thing, is to make it really personable. Talk about kind of your story, but it doesn't need to be dental. You don't need to talk about really dentistry. It's some people make the mistake of talking too much about dentistry, or they talk too much about ortho in their personal statement. It doesn't need to be. You can have 1 paragraph talking about your shadowing experience, and even then, they don't really want to know that you did this and you did that. Technically, as a pre-dental student, you really can't be hands-on, and that's sometimes readers will kind of look suspicious, because they're like, how did this patient do this and that? They're pre-dent, they can't be touching things. So kind of be careful. You're shadowing, touch base on that, but really you want to showcase your qualities, not talk about dentistry and all the procedures you watched and what you assisted in. Don't get into that. It's really kind of like what you learned from the experience. Showcase your skills. That's like the biggest thing. Like I said, like my academia, I talked about the challenges I faced with my students. When it came to shadowing, I touched briefly about kind of what I learned, kind of stuff like that. If you did any mission trips, I know now obviously with COVID it's harder, but if you have done any mission trips, that's something to talk about. I think I went to New Orleans while I was in college, and we rebuilded houses for Hurricane Katrina. I was there for like a week. So I actually, I spoke about that, and I spoke about, the language barrier, like the barrier, the difference and the diversity of from where I'm from versus where they were from. Stuff like that is kind of like doesn't need to be like, my mission trip was not dental related at all. It was, we were rebuilding houses. But again, it was showcasing a quality of mine. So anything that can showcase a good quality, that's what you want to write about.
Thank you for that amazing advice and input. Another student asked in the chat, does it count as leadership if they have experience as like a manager or a certified trainer at a restaurant for about like 2.5 years if it isn't dental related?
Yeah, I mean, that's still great. Like I said, it does not need to be dental related. That shows leadership, right? Being a certified trainer, a manager, again, that shows many things, right? And I'm sure, again, I'm not familiar, but I'm sure there are many qualities. If you can touch base on an experience you had when you were a manager or certified trainer, that's great, because that can show your leadership. It can show your interpersonal skills or communication. Like I said, it does not need to be dentistry related. Sometimes, to be honest with you, they like it when it's not even related to dentistry. Okay, they don't want to see application after application, students doing the same things. Okay, talking about dentistry. You want to stand out, and these are things that like kind of make you stand out.
Kind of going back a little, a student asked, where are the conferences for ASTA like usually held?
So they have, again, there's district ones and there's national. So the district ones usually are either in Southern California, they alternate between Southern California and Northern California. The national ones, they've been everywhere. I'm trying to think. I mean, one year I think was here in LA, but another year was like on the East Coast. Where did we go? I have to look into it because I don't remember. But yeah, they're all over the place. I think one year we went to Texas, I want to say, or some on the East Coast, Florida. We went to. I don't quote me on it because I'm not sure. But again, they're all over the place. Some of them will be like on the West Coast. Some of them will be on the East Coast. The national ones, they're students from all over the United States.
Thank you. And another student asked, could you go more into detail about like the back pains experience in general dentistry?
Yeah, I mean, I will say posture is very important. If you learn in dental school, good posture, I had classmates that really, really, they trained themselves. They trained themselves to use indirect vision, right? So, I unfortunately did not train myself. It was something that I kept hunching over. Again, if you train yourself from the beginning to use your loupes, which are those magnifying glasses, if you train yourself to always have good posture, you're going to have an easier time. Some students like me, I didn't really train myself. I always hunched over to see everything and I wanted to see some, again, partly was my fault. But in general dentistry, if you ask anyone, it is, it's straining on your body just because, you're sitting and you're working with your hands constantly and you do have to kind of hunch over at times and, it's not very active job. So, you do, like I said, like my husband sometimes does have some, neck and back pain. It's just something to keep in mind. Again, there are many dentists out there. I think if you practice good posture from the very beginning of dental school, I think you'll have a much easier time and a longer career. So yeah, that's something to keep in mind is like when you get into dental school, and they'll teach you, and the first thing you'll learn is about posture and about using your magnifying glasses, all of that. So they'll teach you all of that. The key is to just keep, training yourself and, make sure that you're doing it. And if you do that, I think it can lessen the neck pain and the back pain. But yeah, I mean, that's honest. I mean, that's something that comes with dentistry, unfortunately. Again, ortho, thankfully, you know, it's not very straining on your back. But yeah, it's something to keep in mind. I would say talk to different dentists. Again, I didn't really practice as a general dentist. I did it while I was in dental school, but talk to different general dentists who've been working for many years. I think those are probably the best people who've been working maybe for 5-10 years, right? And not someone who's been working for just a couple months, right? But they are probably better to ask and see how they've handled it, and how their experience is, and I think they're better people to ask.
Thank you. So how did you find or like get involved with research that's aside from general biology or chemistry research?
So is the question like you want to, so if you want to get involved with dentistry research, you kind of just have to email and just reach out to faculty. I mean, once you get into dental school, you'll interact with so many faculty. You just have to just go up to them and say, hey, are you looking for someone to join your team? That's the best way. I know most of my classmates who found research, you just go up to the faculty, or you email faculty. Most faculty, in dental school are doing research. Even in college, most faculty in college, they're all doing research. So essentially, any faculty that, you come into contact with that you like, and you develop a relationship with, it's great to ask them, don't be shy. I would say email and ask as many people as you can. But your faculty are your best resource. You can find out what research they're doing, and if that what interests you, ask them. I mean, that's, I think, the best way is through your faculty.
Thank you. And when you were preparing for the DAT, how did you prepare for it, and what resources did you use, and how long do you recommend students to prepare for the test?
So DAT, I gotta think about it. It's been a little while. So I okay, so I studied for it for 3 weeks. I will say I was crunched on time because I was in school and I didn't have time, and I was on break, winter break, for 3 weeks. So I quickly crammed it in 3 weeks. Obviously, I would recommend you dedicate at least a month, 2 months, okay? But I did a lot of practice exams. I think those were really useful. I did a lot of practice exams. I want to say I used different books. I don't remember. I have to look into those. Whoever asked that question, you're more than welcome to DM me, and I can look it up on my computer. I know I didn't do an official program. I know there are some classes that you can take. I didn't do. I did all self-study. But yeah, I took 3 weeks, but those 3 weeks I really kind of locked myself, and I really studied really hard. But yeah, I did a lot of self-study. I know I used a book. I don't remember what the name of the book is. Probably one of the popular ones. If you Google, usually kind of it's one of the ones that everyone used. And then once I did kind of the foundation, then I did a lot of practice exams. There are a lot of practice exams that you can use. I did those. And yeah, I would say I don't know if the DAT has changed since I've taken it, but the PAT section was the section I struggled with the most. So I will say, if that's kind of one of your weaknesses, focus more on that. But yeah, the practice exams will really tell you kind of where your strong your strength and your weaknesses are. So it's good to do a practice test to see kind of where you need to focus more of your time in. But yeah, I think that's pretty much what I did. Again, sorry if I'm not too I don't remember since it's been a while, but again, you can message me and I can look into it.
Thank you for that. And so since you just finished dental school, what would you say was the most challenging aspect of it?
Dental school or residency? So dental school, I would say probably the challenging for me was just the clinical work, was the lab work. We had a lot of requirements. Again, this has changed. I don't know if they have requirements now, so don't quote me on it. But when I was in school, in dental school, we had a lot of requirements. So I think the most challenging was meeting those requirements and getting patients. Getting patients wasn't the easiest. I think that was the most challenging. Didactically, there's a lot of studying you have to do. I mean, your first 2 years, it's a lot of studying. But I mean, again, for me, the studying was doable. It was the clinical that I struggled with, the lab work. Once you get into second year, you have a lot of lab. And that includes doing dentures, and you have a endo lab. You have a lot of lab classes. Again, it might have changed since I graduated, but I think that was kind of, again, because I wasn't so great with my hands, I struggled with lab. But yeah, I would say either students really struggle with the didactic portion, or students struggle with the lab. And some people, the lab comes naturally to them, and I had classmates that were really good at lab, and it just came natural, and some people struggled like me. So yeah, I would say I think those were kind of the biggest challenge for me while I was in dental school, and really learning how to manage your time. You have to not only do your schoolwork, but essentially if you want to do a specialty, you need to be able to do other things, right? If your goal is, is to not do a specialty, then your job is easy, right? You just graduate. But if you're trying to get into a specialty program, you really have to be good at time management. You have to set aside time to do research and set aside time to be involved with other organizations. It's definitely doable, especially when you get into your third and fourth year. The load does get lighter, especially third year. You see patients. Third and fourth year of dental school, you're essentially seeing patients almost full time. You still have a few classes, but it's not as much. But yeah, I would say just being able to manage your time. For me, first year was really hard because you have to be able to juggle many different things. But eventually, you'll adjust and you'll learn, and it'll become easier.
So, kind of piggybacking along that. So, how did you balance your time while you're in school and like during residency, and like just how did you balance your work and family life?
It's really just a matter of setting aside time. I'm a very like schedule-y person, right? So I like to make schedules. I set aside time for studying, but at the same time, I set aside time for whatever it might be with family or my friends or doing extracurriculars. So I think that's like really the key is to not just focus, see what your strengths are, right? If you're really good at lab, then that's great. You don't need to spend so much time in lab. If you're good at didactic, right, then you don't need to spend so much time studying. I think the key is really to really see what your strength and what your weaknesses are and really have a schedule. I think that if you're organized and you stay on top of your stuff and you don't procrastinate, I think that's definitely, it's doable. I mean, those who procrastinate, I think, have a harder time. But if every day you're studying a little bit, if you're on top of your lab work, and I think that's the key, is because especially in dental school, you don't have something due every day, right? They give you lab work, they give you piles up. So essentially, if you don't do it, you might come to the due date and then you have like a bunch of things that are due. So the key is really to stay on top of it, to not just to leave it to the last minute, is every day do a little bit. And if you do that, then I think that's fine. Have a schedule. Yeah, I mean, I have my schedule on my laptop, so I keep everything color coded. You'll develop your own system, but you'll kind of, it's through time, it's through experience, you'll learn how to manage your time.
Thank you for that advice. And another student asked, is there any chance to follow a specialty like once you've already graduated and are working as a general dentist?
Yes, of course. Like I said, actually, some schools, really like it when you have experience. So, I know actually tons of people that have worked for 1 or 2 years and they've realized that, they wanted to do a specialty. And that's great. That's experience and that's work experience that you can write on your resume. So that's like a bonus. So I would say definitely, yeah, if you're motivated and you want to go into a specialty, definitely do it. It's never too late. And schools actually, that looks good to them. So don't think that just because you've worked, it's game over. It's definitely not. You can still apply. There are people that even do it after 3 or 4 years. So yeah, it's a bonus. It's just more work experience.
So did you and your husband get married during dental school, or did you guys wait until you guys graduated?
We actually got married recently. We got married in June during this whole pandemic. Yeah, so we met in dental school, but yeah, we didn't actually start dating until our last year of dental school. And then I was in residency at Loma Linda. So Loma Linda is about an hour and a half away from here. So, and he had just started working. So we were kind of doing our own thing. And I came home every weekend, but we wanted to wait until I was, pretty much done with residency before we got married. So yeah, we just got married in June.
Well, congrats.
Thank you.
And another student asked, what is it like to be a woman in dentistry?
I will say it's awesome. I mean, as you know, women are becoming more and more involved in the healthcare world, right? We have many, many women doctors and dentists, especially as an orthodontist. I mean, there's, I mean, as much as there are females, I will say there's probably more males that are orthodontists. But, with time, females are, there are a lot more females now, I'm sure, than when they were years ago. So it's difficult. I will say, especially as a female. I'm more of a petite person. I'm shorter. So I come off as being really young. Okay, and that's something that as a female you do kind of struggle with because especially if you know males typically are taller, and they look older. So that's something you will kind of face where sometimes patients might not necessarily trust you, right? Because they say, oh, she looks so young, how can she be an orthodontist, right? And I've gotten that, they're like, you're an orthodontist, you look so young. And that's, as women, that's, unfortunately, you will get that. But as you kind of develop your relationship with your patients, they will trust you. At the beginning they might say, hey, you look young, but as you develop that relationship with them, you communicate. The key is, as women, we are great communicators. So use that skill, communicate, be really thorough with your patients, explain everything to them. And I think if you do that, with time, they will trust you. And yeah, I got that during residency. And, I think in every field, it's like that. It's not only ortho, right? It's every field, especially women that, look younger, sometimes are questioned by their patients. But again, really, there are more and more and more females assuming, healthcare roles, and that shouldn't discourage you. And actually, when offices are looking to hire jobs, they actually love females because they know that females really communicate well. They're they're very interpersonal, right? We really connect with our patients. So yeah, I mean, it has its challenges, but it's super rewarding, and it's going to get even better with time.
Thank you. And is there anything in like particular that gets you excited into like coming into work every single day?
I mean, truthfully, it's my patients. I know when you develop relationship with your patients, and I see a patient on the schedule, like I get super excited. I say, oh, I'm going to see this patient today. I wonder how their teeth is going to look, right? Because you do an adjustment, right, and then you don't see them for another month or month and a half, right? And so you're excited to see how the teeth move. Honestly, that sounds silly, but that's really kind of what gets me excited. Is if I do something, I want to see kind of what's the impact, right? 4 weeks later, right? It's not something when you do an adjustment, you don't see the product right then and there, right? The product is later. It is sometimes a month, 2 months, a year sometimes until you see the finished product. But that's really kind of what gets me excited is especially when you develop those relationships and you come in and you see, you're like, oh my God, this tooth moved, or we got this done, or like we closed the bite, or something that you've been struggling to do. I think that's the key, is that I like I said, I love ortho. I mean, so far I've loved everything about it, and truthfully, it doesn't, it's a job, but it doesn't feel like a job. My days go by super fast because, again, you're seeing so many patients that, days are going super, super fast. And yeah, I mean, that's what gets me excited. I mean, just to see my patients, and you'll learn a lot about your patients, right? You'll see them, and then they come back, and they're also going through puberty, a lot of them. So it's such a great, you really, really develop relationships with your patients. They'll you'll get to really know them, what they're going through, their school, because again, you're with them for like 2 years sometimes, or even more.
Thank you. I know you kind of previously touched upon this, but what did you do as your extracurricular activities for your volunteering aspect specifically?
To get into dental school, I believe. I did I shadowed, and then volunteering wise, I did a lot of volunteering. I just have to, again, I have to look at my resume because it's been a while. I know that, again, like I did, I shadowed a clinic, and I did a lot of shadowing with a pediatric dentist in a low income, it was a clinic in LA. And then what else did I do? Again, I have to, again, whoever asked me that question, feel free to message me and I can take a look at my resume. I should have looked at it before, but again, it's been a while. I don't know. I did a lot of volunteering, I will say. I did quite a bit. But I have to look and see kind of what the specific, what specifically volunteering I did. Not all of them were like dental related. I believe I did a lot of volunteering that even wasn't really like dental related. I think I volunteered, I believe at like Cedar Sinai, a medical center, and I did a lot of volunteering there. Um, but yeah, again, I can look it up and let you know kind of what specific organizations I volunteered with. But I'd say anything you can find, that's community outreach, even if it's not dental related, I would say go for it. That's great to add to your resume.
Okay, thank you. And this is probably our last question for today, but how do you persuade difficult patients to trust you and get them to cooperate with you?
Again, the key is during that consultation appointment when you first meet the patient. You need to really, be approachable. You explain everything to them. Again, with ortho, the great thing is they come in, they want braces, right? I have kids that come in and say, I want braces, right? That's easy. There are some kids that don't want braces, their parents bring them in. Those might be a little bit more difficult because those patients are not as compliant. Their parents want them to get braces. But again, it's really, you make it fun for them, right? So for example, like with braces, you get to pick a color each time you come, right? Those of you who had braces, every time you come to an ortho office, probably the most fun part is getting a different color. We make it fun for them. I also try to explain everything to the patient and the parent. The key is not to just tell them, hey, you need braces, right? And it's going to take 2 years. The key is to explain to them why they need braces. I always show them the photos. I show them the x-rays. I say, this is the reasoning. If you don't address this now, this could happen. If you really take the time to really speak to your patients about like what the cause is, how to address it, they'll start to trust you. The key is to really communicate with your patients. Take the time, don't be in a rush, answer all their questions. And yeah, they'll naturally over time, especially as they come and see you, with time, they'll trust you more and more. But the key is during that consultation, that first time you meet the patient, and that's with every specialty, right? Even with general dentistry, the first time you meet the patient, that's where you leave your impression. The more you're smiling, the more you're approachable, and the more you communicate well, you explain everything, you answer their questions. And the more that they're going to trust you and they're going to cooperate with you.
Well, thank you, Dr. Ghiam, for all your time, and we really appreciate you for presenting and informing us all about residency, what it's like in residency and in dental school. And for those of you who are still on the YouTube live, we will post the quiz on GroupMe and in the YouTube link. And thank you, Dr. Ghiam, and everyone who participated today for joining our session.
Of course. Thank you for having me.
Thank you.